Welcome, wamkilekile, qualifiers, family, friends, staff, guests. You may be seated. Congratulations on getting to this point of qualifying after years of hard work and dedication, acquiring knowledge, developing skills and competencies as new healthcare professionals. We welcome you today to this most auspicious event of commitment to a profession, to a life of service with humility and integrity. I'm Dr. Karen Begg. I'm the Deputy Dean of Undergraduate Education at the Faculty of Health Sciences, UCT, and it is my honor today to lead this particular ceremony. Our Dean is currently with the installation of our new Chancellor, and so is unable to be at these two ceremonies, but sends his best wishes. And he will be with us in spirit in a video a little later. So colleagues, we just ask you now to just be present in this moment. It's been a long, tough week. There have been lots of things happening. Exams have just recently passed, a few celebrations in between. But we really ask you now to just be present in this moment today, as we are about to do an incredibly important component of ensuring that as you take the oath and pledge yourself to serving humanity for your careers starting now. We're going to hear now from the Dean, Professor Lionel Green-Thompson, as he's going to share with us a recording of the importance of oath-taking and what it means. Thank you.
Welcome to this oath-taking ceremony. Every time we take an oath or make a declaration, we're telling the story of the promises that we make. And if one looks through history, you see that oaths themselves have emerged at different times in our history as health professionals to help us come back to that straight and narrow, so to speak. And today is no different. You're being invited to make an oath, to make a promise to people who surround you. And for me, it's quite a powerful occasion that in fact you are here with guests that you have invited. So each of those guests represent millions of people outside of this room, in the country, in a country which is often suffering great hardship, and to whom you will come to give them some kind of solution to their problems. So as you take the oath today, be mindful of a couple of things. Mindful of this idea of promise, that every time we make a promise, it doesn't mean that we never fail at fulfilling the promise, but every time we make a promise, we're suggesting that we can do something to make tomorrow better for everybody. And that's what this oath is about, is that even as you go into your internships, your community service years, in very difficult times as a result of the pandemic, you too make a promise. And the promise is simple. The promise is that every time you engage with a patient, you value them in that particular interaction. You treat them with a sense of love and respect. And you recognize their vulnerability in the moment in which you engage with them. The oath will invite you to comment on and make a promise to ethical behavior, professional conduct, and lifelong learning. These are the things I wish for you, because often the systems in which you will work will challenge those very values. But the idea of lifelong learning has become such an essential part of our response to the pandemic that for you, it's going to be part of your daily life. For you, you're going to have to make decisions, remake them, and change them repeatedly as you begin to work in a complex environment. Don't be afraid of changing your mind. That's the nature of a self-transformative self. You're able to look at the facts that you're presented with, engage with the conflicts that arise as a result of your patients having a different worldview to you. Increasingly in our world, the exclusion and marginalization of transgender people become a very real challenge to your practice of healthcare. Make sure that nobody feels left on the margins of society after they have engaged with you. That's what this promise today is about. And that's why we take a decision to gather you here. One, because an oath only has meaning because it is made in the company of others. And two, that there are representatives in that community that gathers of people outside of the profession. This is what this oath taking is all about. And I do wish you well as you take your oath, and that each day you may get up afresh, promising to do better that day, or to keep your end of the bargain. I wish you well and safety as you travel on your professional journey.
So today, colleagues, is about the oath. This is not a graduation, and we just wanted to remind you of that. Graduation is a specific governance component of a university where the congregation is called by the Chancellor. The Chancellor opens the graduation ceremony, and the degree is conferred only during that time of the congregation being opened and then closed. And so today you don't wear sashes like we do because you're not yet graduates, but you are qualifiers and you are graduands. And once the university has opened the graduation ceremony, who knows what COVID will bring in terms of ceremonies, but the graduation ceremony will either be in person or online, and at that point you then become a graduate. So today is really about making a commitment, and that is the uniqueness of our faculty and our particular degree programs, is that you are becoming health professionals, that you are not just simply a graduate with a degree, but you are entering a profession. And so we'd like each of the guests, those who are able, to just stand for the moment, and for the qualifiers. So if you can just all stand, guests. And this is a moment for the qualifiers to look around and see that these are representing the people that you will serve. And you will see that they are representatives, a wide variety of different people, of our communities, of our citizens, of our country, and beyond our shores. And so please just recognize that these are to whom you are making a commitment today. Thank you so much. You may be seated. So colleagues, today we're going to now hear a little more about what the importance is of taking the oath. Some of you may remember many years ago having taken a component part of the oath when you were students, as you committed to a part of being a health professional student. But today we really want to recognize and help you acknowledge the gravity and the importance of this particular occasion, which is so much more than a celebration of 6 years of hard study. This is really about looking forward to saying, this is what you're committing to a lifetime of service in humility and integrity. So we're going to hear from a few alumni and a few community members in preparation before you take your oath. Thank you.
So I remember when I took my oath, I was overwhelmed with a feeling of relief and accomplishment and pride. And the words made perfect sense, but it's only with experience that the words actually take some meaning and really come to life.
As you are taking this oath today, remember, oath is about empathy, professionalism, and care. If you've got those three, you are a winner. Also, oath is about humanity, responsibility of both provider and receiver.
On reflection, the very first line stands out to me, which is I pledge to serve. And so we always need to remember that we are in service of people, not of ourselves, not of money, not of status or societal stereotypes. And we need to serve with integrity and humility.
I really think it's important to actually reflect on the privilege that it is to be a health professional. So many people are trying to apply to get into one of the disciplines at UCT, and for me, you know, it's a massive privilege to actually be sitting here today, or for me to have earned my degree as a physiotherapist. And I think we always have to remember that it's a privilege to actually be helping someone through a really difficult time, that it involves one of the most important aspects of their life, their health.
One of the commitments that you'll make is that of lifelong learning. The commitment to lifelong learning means using the current period that we're going through as an example, is that you see that there's a rapid change in new knowledge, new diseases, and new health challenges. And as a health professional, you must always be at the forefront of research, information, new technology, to be able to respond appropriately.
Coming into the health system, you may often feel that you can't change much. As a group of interns, we were able to notice that one of our wards in a rural hospital really needed touch-ups. It was a children's ward that was quite plain, but we worked together with local businesses, with colleagues, to ensure that we transformed it into a child-friendly ward. This does illustrate that coming with new eyes, you would and are able to change things for the better within the health system.
Working with an underprivileged team and providing the coaches with skills or the athletes with skills to enhance their abilities is amazing. And I think that's the important thing within South Africa, is that yes, we might not have the resources, for every team might not be equal and every hospital might not be equal, but we have so much skill and knowledge as health professionals that it's so easy to actually teach another person.
As a health professional in South Africa, and given the inequalities in our societies, I think it's particularly important for health professionals to be mindful of those inequalities, to do their bits in terms of addressing those inequalities. And that will require us working not only across our disciplines in the health professions, but with other sectors, working intersectorally to make sure that we address the challenges of our societies in a comprehensive manner.
So the oath has guided my daily practice, and I noticed this in my second month of internship when one of the matrons came to me and asked, which university do I come from? So I thought I did something wrong and said UCT. But what transpired actually has stuck with me for many months. So she noticed that there was something different in the way in which I interacted with the nurses, the porters, the patient, and she really wanted to compliment that. That was surprising because I thought I was doing what you should be doing, but she had noticed that as something extraordinary. So many of you will get into the service and think you're doing the normal, but that turns out to be the extraordinary because of the type of education you've received and the type of training that you've received.
And one needs to embrace the good times, but learn from the difficult times, and also look after yourselves amidst all of that, and recognize that you have immense power as a healthcare professional to be a voice for your patients, to uphold their human rights, to serve them, and as cliched as it may sound, to make the world a better place.
It is very important that the student must reflect on their work that they are doing within our communities, especially the marginalized community and vulnerable one. We need to hear the voices of our gogos, meaning our elderly people who are always standing in those queues at the clinic. We need to hear the voices of our own sisters who are domestic violence abuse. Go out there and be advocates for a change.
My message to students is to always remember what a resilient group they are. They are the group that saw the Fees Must Fall movement. They have just survived a pandemic. These are graduates who are going to be able to change the face of South Africa, the face of the health system in the country. And I think whenever it gets tough, every single graduate should remember that they have gone through the most and they will still survive.
I really do feel that these challenges have made the class more resilient, more mature and more capable. And I really look forward to this new generation of more socially responsive and compassionate healthcare professionals.
To you, I say that you've conquered, you've made it this far, and I know that South Africa is going to be a better place because of you. Go well and make us proud.
Congratulations on a remarkable achievement under extremely difficult circumstances. I have true confidence that you will be fantastic healthcare professionals for the communities that you work for. I wish you every joy and success as you embark on this noble and rewarding profession. Much love. God bless.
I would like to congratulate you for a journey well traveled. You have really surmounted many challenges, and we look forward to welcoming you into the health system.
A good luck for your future, and be the lamp wherever you go. Shine. Sithi isiXhosa, ndingantaka baba uvula amaphiko uwatweze. Meaning, fly eagle, fly higher and spread the wings. All the best to you. Halala, enkosi.
Of getting to meet Suki. I think we will all just love that halal at the end. So, colleagues, now it is my honor to welcome the head of the Khoisan House of Traditional Leaders, Chief Mackey, and Headman Adamons, and colleagues. They are here today to represent the communities we serve as health professionals, which, as I've indicated, is incredibly important as we reflect. But they're also here to remind us of the legacy that we come from, the legacy of First Nations, the legacy of indigenous knowledge systems. At the foot of the Hurikwacho, the mountain and the sea, and our faculty is placed in the Place of Stars Observatory, which is a sacred space, Ichamarodi Ichais. And so we'll be asking Chief Mackey to bless the qualifiers ahead of pledging the oath. Thank you.
I'm short, let me. I'm a bit short. Tankwas, it means good day. Tawedes, greetings. Kaesa, blessings. People, I'm sitting and I'm thinking, this place, wonderful space, place on this very most ancient sacred mountain. Hurikwacho, Amase. It means amen and hallelujah. Amasi. People, yes. I'm just thinking, tongue in the cheek. Why not put within brackets alongside the name of the place? I know it's the University of Cape Town. Maybe within brackets, quick Cape, place where the clouds gather. Because there are two winds that blow. Up front, the northwest winds, the rain. At the back, the southeast winds, and then you have the blanket. But remember, Hurikwacho is the Cape Fold Mountains, as the geographers would say, from Cape Point right through Landudno. So it's very, very sacred, it's very, very special. And obviously the river, Amisa, which means the sweet waters, and it's still running underneath the city. People, yes. What can I say? Such an auspicious occasion. except to say and to remind you of our spirituality, createdness, the Great Spirit Creator. We are spiritual beings, we are sacred beings. We carry that within us, undeniably, I must say. We carry it undeniable with us. So you, having studied for how many years, take that with you. Reflect upon what you are about to do. Go into the world, but take along and invoke your spiritual virtues. Those are the important things. And yes, we are all human beings. Kunkwena, Kwensan means human being. Let us remind ourselves that. Let us not look at the surface and become superficial, but let us look into the people and let our journey be inward. We are sojourners. Yes, you're young. Your life might be stretching way ahead of you. But remember, time is a gift, has been given to us. So therefore, make haste, use it well, but never ever forget that. Move a bit away from materialism to the spirituality of humanity. Become a community serving humanity. That should be the way to go from the Aboriginal perspective. Kaya, Gangans, kay Gangans.
Qualifiers, we've come to the important part of the ceremony. Not only are you taking the oath in a pandemic, and congratulations that a third of your degree has been spent in pandemic times and you are still here. But in addition to that, the recent launch of Code Red for Humanity and the WHO COP26 special report on climate change and health, we now today, for the first time, the Faculty of Health Sciences oath will now reflect a commitment to the health of the environment. So you are trailblazers today. We too will be joining you in stating that oath for the first time. I would like the qualifiers to just really center themselves now, to take a moment to ready yourself for this important commitment that you're about to pledge before witnesses. We're here with guests because it is important for us to pledge this commitment before witnesses. Academics and teachers will be joining you in recommitting ourselves to the oath as we welcome you into the profession as colleagues. This is the transition moment from student to colleague. I'm going to ask you to stand in a moment. I'm going to ask Chief Mackey and Headman Dowmans to stand, and they will be the representatives of the communities to which you are committing. So please reflect on that as you are taking the oath now. I'm going to ask each qualifier now to stand. We will be taking the oath together. I will be saying each line, after which you and the colleagues with you will say it after me. We don't want any student to be standing alone. So if any student is standing alone, we'll have an academic come and join you. Can you go and join on the stage? We would like no student. Any other students alone? This is your joining as colleagues. If you have any others who are alone, okay. Can we ask that a family member may just move adjacent to any other person who is alone, just so that there's a sense of togetherness. Thank you. We really appreciate that. Thank you for that. All right, we're ready. As we say the first line, and we say I'd like you to repeat your name. It will sound a little funny as everybody's saying their name, but this is really important that as you take a promise, as you take an oath, that you commit with your name. So you'll repeat after me, and you won't repeat my name, you'll repeat your name. Just saying. All right. I, Karen Begg, solemnly pledge to serve humanity. My most important considerations will be the health of patients, the health of their communities, and the health of the environment. I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation, disease, disability, or any other factor to adversely affect the care I give to patients. I will uphold human rights and civil liberties to advance health, even under threat. I will engage patients and colleagues as partners in healthcare. I will practice my profession with conscience and dignity. I will respect the confidentiality of patients, present or past, living or deceased. I will value research and will be guided in its conduct by the highest ethical standards. I commit myself to lifelong learning. I make these promises solemnly, freely, and upon my honor. Welcome, colleagues. Colleagues, this is here for you with a signature spot, and we even provided a pen. Please be seated and sign your oath now in front of your witnesses. So, colleagues, we wish to thank you all all for attending. I wish to thank my colleagues for joining you, those of you who were now not alone, but joined by colleagues as you took this important step. This event took an immense amount of planning, and every day we had our hearts in our throats waiting to see what COVID numbers were doing. And so we're immensely grateful to be able to hold this ceremony today. But we do acknowledge that we are in pandemic times, and we ask that as new healthcare professionals, that you recognize the importance of the role that you play in role modeling to those around you and in advocating in order to reduce the risk of transmission of COVID. So we ask that as you take photographs and as you celebrate today, that you recognize that we are still in pandemic times, that you keep physical distancing, that you keep your masks on, take them off very briefly and hold your breath while you take photos, and then pop them straight back on again. But please, we would ask you to please recognize that we have honored, we feel that this is really important, but we've done it in such a way that we expect that you would behave as the health professionals that you've just committed to. So as you move out shortly, we will ask you to try and move further down Jamison Stairs so that we can start the next ceremony within the next half an hour. I think that your class is having a class photograph, so we would ask that you try and be as efficient as possible so that we can not have too much crossing between ceremonies, but just so that you all take that into cognizance, please. Please don't forget to return your gown before you depart from campus. And I just really would like to thank the undergraduate academic staff for pulling this ceremony, these set of ceremonies together. We would have all been a lot hotter if we'd all been together. So we are grateful in some ways for COVID, that we have a little bit of space between us. But just a huge vote of thanks to the teams who've pulled this together. Colleagues, this is really important that we are only, those who are present here today have qualified. We have assessed all of the results. So those of us in the undergraduate academic team have reviewed approximately 1,500 students' results, times as many years as you've been at university, times as many courses as you've had. So we have results coming out of our ears right now. And the only reason you're here is that we were able to put all of that effort in to confirm that you have qualified. A few of your colleagues may not have qualified yet, and they will be qualifying next week once they've completed supplementaries and other commitments. But the reason I mention that is that these colleagues, these same colleagues who've been pulling together all of these results, are the same colleagues who've managed to put these events together today. So in spite of one or two very small glitches, we are immensely grateful for them being able to put this together today. So please, can we give them a round of applause? And so, colleagues, we come to the end of this important and wonderful celebration. We're going to ask you to remain seated as the stage party exits. The ushers will assist you out in rows so that we remain physically distanced for the exit. And so, as we now depart, we wish you strength and courage as you forge the path ahead. May you listen with compassion, walk with humility, and act with justice. Congratulations. We are very grateful to Guy and her team who are going to lead us out with some celebratory sounds. Thank you so much. Woo!